Hello, my name is Cody Chip. I'm the Director of Beaver Health for the Alaska Native Tribal Health Consortium. In this video, I will be describing what syndromic surveillance is, why it's a valuable tool for public health, and why it's a valuable tool for healthcare facilities and tribal health organizations across our state. Syndromic surveillance is unique because it can be used to anticipate negative health events in their early stage before diagnoses can be confirmed. Syndromic surveillance utilizes electronic health record data, or EHR data, in almost real time. The idea is to allow healthcare systems and public health entities to quickly respond to increases in specific symptoms. This is especially useful in my work, as syndromic surveillance can be used to quickly track behavioral health trends, such as overdose clusters, even without diagnostic codes. This extra time can potentially prevent large-scale disease transmission. Syndromic surveillance goes beyond diagnostic codes. It uses an analytic software to scan most of the medical record, including provider notes and other unstructured fields, in order to track symptoms, identify potential cases, and flag trends. So how does this work? It's all made possible by data, and this is how the data flows. When people visit a hospital or clinic, their secured data from that visit is sent to Alaska's Health Information Exchange, which goes by the name Health eConnect Alaska. Health eConnect Alaska sends data from all participating facilities in the state to the Alaska Department of Health, or DOH. DOH relays this data to the BioSense platform, which is the data warehouse for the National Syndromic Surveillance Program, or NSSP. The NSSP is a collaboration between the CDC, state and local tribal organizations, as well as federal, academic, and private sector partners. Once there, the data is uploaded to a system called Essence. Essence allows participants to access data and create queries to track different syndromes and conditions. With Essence, the state of Alaska is able to view and analyze the data. It's also a valuable resource for regional facilities, clinicians, and analysts. A common example of syndromic surveillance is using influenza-like illness to track the start of the flu season each year. When healthcare facility visits showing symptoms associated with the flu, such as low fevers, coughs, sore throat, rise each fall, it can be an indicator of the beginning of the flu season that health departments can take note of before laboratory diagnoses are confirmed. Other examples where syndromic surveillance has been used to easily identify adverse health events would be impacts of wildfires, discovering drug overdose clusters, monitoring health effects from large community events, or outbreaks of foodborne illness. The best way to illustrate the progression of a potential outbreak is by graphing a basic epi curve and following the path of a simplified outbreak. This graph shows the number of cases over time. Normally, there is a natural fluctuation of cases. Then there's the beginning of an outbreak, and cases start increasing. Here, we have an area where public health recognition of an outbreak would be optimal, labeled point A. This would be an ideal time to recognize the outbreak. This point is optimal because it gives us time to meaningfully intervene. Syndromic surveillance allows for intervention at or around point A because it tracks symptoms and syndromes before diagnoses. This continues up to the peak of the outbreak where cases start declining, point B. At point B, we could still intervene, but less effectively. And then we reach the end of the outbreak, point C. And at point C, intervention is the least effective as cases are declining. The advantage of syndromic surveillance is that it can decrease delays in the detection of a health concern by observing and recognizing symptoms or syndromes before diagnoses and almost in real time. If your organization is interested in learning more about syndromic surveillance, or if your team is already using syndromic surveillance but would like more training and support, ANTHC's Epicenter can provide help. They can help with training, creating shared dashboards, and creating weekly reports.